The goals of today's panel are to introduce endotyping to trainees or earlier learners, just to go over the basics and basic understanding of what endotyping is. We'll discuss some higher level things such as practicalities and protocols. We'll go over some cases and go over higher level discussions that entail therapeutic decisions and research opportunities based on what we learned from endotyping. So endotyping and phenotyping, we have our classic CRS phenotypes, chronic sinusitis with polyposis and without polyposis, the age-old dichotomy. And within these, phenotypes, we have different behaviors, such as that we all know well, such as ARD, EGPA, allergic fungal, cystic fibrosis, CCAD. Within non-polyposis, we have the infectious GPA, immunodeficient patients. We have odontogenic, autoimmune, PCD. How do we endotype? Do you use endotyping, or are you still using largely the phenotypic paradigm to treat CRS? Does endotyping research further suggest substantial clinical and scientific relevance, in your opinion?
Most definitely. I think we've focused a lot on endotyping for nasal polyposis just because of the clinical relevance in therapies. We've seen how biologic therapies can really help impact control and treatment of nasal polyps.
It was just so eye-opening and to kind of think now with the mixed subtypes. And I think it's really exciting to see where things are going.
It's a great question because when I presented the idea of structured histopathologic reports to my pathologists many years ago now, one of the two hospitals I worked at was very quick to say, yes, no problem. The other hospital really dragged their feet.
The first thing I say is remind them that it's a chronic process. If we're heading towards another surgery, if that's what the patient decides, the goal is to improve their symptoms and hopefully I get a much better result than their other surgeries, but also reminding them that if a single polyp returns or two polyps return, that's not a surgical failure.
Would anybody take this patient off of his biologic?
I think that controlling their allergies is going to help control their central compartment atopic disease.
She had grade 2 polyp on one side and a grade 3 polyp on the other side with purulence as well. Every time I saw her, she initially opted for medical therapies, but she kept failing medical therapies, so we opted for a CT scan. I really appreciate you for your contributions. This was really terrific.